Hi guys, welcome to Nursing Forward, where we talk about things that really will progress our profession into the next century, because it's about time that we had a revolution, and I think it needs to start today. Today I want to talk about abuse in nursing and why in the world do we take it? What is wrong with us nurses? So if you are a nurse, whether it is your first year or your 45th year, you know what I'm talking about. We have patients and even family members who will yell at us, who will threaten us, who will hit at us, kick at us, spit at us, you name it, they will do it, and they have done it. I have been a nurse for 1 year, people. I graduated from nursing school in March 2018. I started working in July 2018, and it is currently August 2019. So over a year I've been nursing, and I have had patients threaten me, kick at me, hit at me, not spit at me in this role as a nurse, but I was a tech before. I don't even think anyone spit at me then, but I have had patients with spit hoods, so they had a history of spitting. I have had family members in my face. Well, actually it was just one, and that is what has kind of inspired this video. Let me just tell you about it, because honey, you need to know. That's what this video is about. It's about nurses being abused, and it's so sad because we take it. We are just so used to getting it and having our bosses be concerned about the likelihood to recommend number. For those of you who don't know, hospitals send surveys out to their patients who have been discharged, and there's a likelihood to recommend score, and that score needs to be high. I work in an ICU, so we don't discharge patients directly from the ICU very often, but when we do, our numbers are often quite high. Right now, my ICU has the highest numbers in the entire hospital, and I think it's been 2 consecutive months that we've done that, because we give amazing care. I am a part of one of the most amazing intensive care units. I am so blessed. I love my unit. But I'm getting off track. I'm sorry. We're talking about abuse in nursing and how we just take it, how we almost expect it and we brush it off, and we shouldn't. We really are being abused, and it's not right. It's not fair. I had a patient just the other day, my last shift that I worked, my patient was abusive. He was calling everybody stupid, idiots, nincompoops. We didn't know anything. Granted, he was confused, and I understand. Patients get confused in the hospital. They say things they don't mean, and we just take it like we're robots or something. I don't know. It's not right. We shouldn't have to take it, and we shouldn't. I feel like no other profession would take it, but we are so caring and compassionate that we just, we rationalize that they didn't mean it, and they're so sick. But I had this patient who was doing that, and the medication would have worn off. The wife was blaming it on an Ativan that was given to her husband at 5 a.m. the previous day, and it was something like 10 a.m. the next day. The Ativan would have worn off, my friend. So no, it's not the Ativan making this patient aggressive and mean. He was like that before they gave the Ativan. That was the reason for the Ativan, for his aggression that could not be controlled. And so next day, 10 a.m., he's calling us names. He's accusing us of you trying to hurt him, trying to lock him up. And so I know he's having this delirium. I wasn't blaming the patient. That's not the point of this video. The point of this video is that we shouldn't be taking it as easily and casually as we do, nurses. I don't know what the solution is, but there's gotta be one. We are a group of intelligent people. We need to come together and come up with a solution, because nobody's going to do it for us. Obviously, no one has, so we need to do it ourselves. This wife looks over at me as her husband is saying all kinds of horrible things to myself and my nurse's aide, and she says, "You probably get a lot of patients like this, huh?" And she kind of chuckles it off, and I say to her, "No," even though that's a sad lie that I said, because we do handle it way too often. Far, far too often. But he was out of line, screaming and yelling horrible things. People could hear it in the next unit. That's how loud he was. He wasn't the only patient this week. One of my nursing friends, Pamela, had a patient who was yelling and screaming at her obscenities, calling her profane names, and she just had to take it. The wife came in and said, "Oh, well, he doesn't mean it." Well, we know he doesn't mean it, but it doesn't make it hurt any less. We're coming to work, and someone that we're working with is calling us profane names, and because they're not feeling well, you expect us, no, don't take it personally. It's easier said than done. Trust me. Any other profession, if this was happening, they would be outraged, and so should we. We don't have to take it, and we need to get out of that mindset where we do just take it. Those days have got to be behind us because we are a strong, noble profession. We are there for people in their worst moments, and that's something that humbles me about my job. Like I said, I work in the intensive care unit, and so every day that I go to work, it's my patients and their families' worst day. It's the worst time of their lives. They've just had a stroke. They've just had a heart attack. They're going into or recovering from a major surgery. I'm so humbled by that, and I feel so honored to take care of those patients in that, their worst day, and to be there for them, to be strong for them and help them through it. It is an absolute honor to do that. But we do not deserve to be called names, to be threatened. The man who was out of control was threatening to choke us, me and my nurse's aide, to kick us, to hit us for trying to give him excellent care. It was just out of control, and we don't deserve it. And my friend Pamela, she brushed it off. She's so strong. She's so amazing. I am in awe of her because she was dealing with mental abuse all day long. And she made it look like it rolled off her back. I'm not sure if it really did. I hope it did because she's such a wonderful, strong, loving person. But it was bad. People don't need to treat us like that. We need to get together and we need to find a way to make abuse of nurses stop. And guys, it is not just the patients who are mentally abusive to nurses. It's also family members. Just last week, I had a patient, amazing family and friend, except for the father. The father was confrontational from the start. I went in to meet my patient first thing in the morning after I'd gotten a report, and the dad was already jumping down my throat, trying to fight with me about every little thing, from making sure that the patient worked with physical therapy and occupational therapy, making sure that the patient had a swallow eval after being intubated for multiple days in a row. He just wanted to fight with me about everything. Everything was a confrontation. He would not back down. And I was just doing what was best for my patient. And this person wasn't just confrontational with me, but he was confrontational with everybody from the minute his family member hit the unit until the minute that we transferred him out of the ICU. Just wanted to fight with everybody for no good reason. I get that when you're in the hospital, or when you're in the hospital, especially the ICU, you are terrified, you're scared, and you probably don't trust anybody with your loved one's life. I get that, but be nice to your nursing staff, because I can tell you that kind of behavior makes everybody want to avoid you. It makes the nursing staff, the nurses' aides, PT, OT, speech therapy, the managers, it makes the doctors, even I have seen doctors avoid family members who are difficult to deal with because of that reason. It makes everybody want to avoid you, which means your loved one, no matter how wonderful the nurse is, they're going to avoid your room. They're going to do the bare minimum that day for your loved one. And it's not because they don't want to do more, because we do. We're in the business of caring because we do genuinely care. But that kind of behavior, that kind of confrontational, in your face, barking down at us, makes us naturally want to avoid the thing that's causing us anxiety. And that's you. So family members who are too abrasive, knock it off if you want your family member who you care about and you love to get excellent care, because I'm a compassionate, caring nurse who goes above and beyond for my patients. But for that patient whose father was jumping down my neck within the first 5 minutes of meeting me, I did the bare minimum that day because that's all I could take. I could only be in that patient's room for the 3 or 4 times that I had to be in there because of that patient's father. Don't be that father who's mentally abusive to the nursing staff, not only because it makes you look like a jerk or like the jerk that you are, but because you are causing harm to your loved one without even realizing it. Yeah. How does that feel? I'm just kidding. Doctors do it too. That's not okay. That needs to phase out. And I think it has been. We have a lot of residents in my hospital. These baby doctors are so cute, but they tell me all the time how much they respect nurses and how they feel like part of their rotation should be shadowing a nurse to see what nurses do. Because we really do work hard, and they see that now in this newer generation. I see all the time with the older generation of doctors where they treat us like we're their secretary, like we're just there to do whatever it is that they deem necessary. That's not the case anymore, docs of the past. You need to get over that and stop mentally abusing nurses by telling them they're stupid or giving them attitude that you wouldn't give anybody else. You need to respect your nursing staff, and your nursing staff will in turn respect you and surprise you by the amazing things that nurses are capable of. Just saying. Guys, I know this was a really heavy rant, but it's something that needed to be talked about because we take it too much and we need to stop taking it. Nursing forward is all about moving our profession forward. There's a need for us to really push forward and make it known that the nursing profession is a strong profession that stands alone from doctors. We are strong, wonderful people, and the world needs to know about it. So until next time, I love you all.